Hi, I'm Carrie Watson, and welcome to this video on the Do Influence. I am so excited to be involved with this project and very excited that you've tuned in. And I'm hoping that I can be of some help in your process of figuring out what you want to do for a living. So let's jump in. So, what type of physician are you, and what type of training did that involve? So, I think you'll notice on here there are several physicians who have participated in this project, and I am also a DO. So, that's a doctor of osteopathic medicine. So, we also have our counterparts, which is an MD, and they are allopathic medicine. So, what does that mean? There is, a lot of definitions out there, but more than anything, you'll kind of get the idea that going to a DO school, you have some additional training that involves osteopathic manipulative therapies and treatments with the concept of treating the whole person. So, I actually grew up in a household where my dad actually taught at an osteopathic facility in Oklahoma. And so that's where I first got exposed to osteopathic medicine. And for me, I'm proud to be a DO, and it's the path that was right for me. So I absolutely would mention to anyone out there who has kind of that idea of the holistic approach and looking for other means of treatment. I think the world of osteopathic medicine may be right for you. But as a kind of provider that I am a dual certified surgeon in trauma critical care. So I practice emergency general surgery as well as trauma surgery. And that means that I'm the person who, on people's worst days, they're coming to the hospital after being in a car wreck, falling off a roof, being stabbed, being shot, falling from standing, all of these different things that people go through in life. And I'm the person waiting for them in the trauma bay. Or I may get consulted whenever someone has a fracture or an injury that needs to go to the operating room. I also practice emergency general surgery. So, what that means is, which is my true passion and I absolutely love to do, is I get to be the person to walk you through going through something as scary as having surgery. So, it's things like taking your gallbladder out, taking part of your colon out, your appendix, small bowel obstructions, large bowel obstructions. I mostly deal with things in the abdomen, but on the occasion I have to go into the chest for hemothoraces or bleeding into the chest. Of course, if there's any injury involving the major blood vessels and trauma to the neck, to the legs, to the extremities, I have to deal with those too. And then the other certification that I hold is in critical care. So I did additional training for that. And what that means is I work in a trauma and surgical ICU setting. I take care of those patients who require critical care. So people who are on a ventilator, who are on medications to help control their blood pressure, to keep it high, to keep it low. Anyone who is in critical condition with their organs failing. So I get to be lucky enough to be the person who can be there and help people through again their worst days and guide those families through that. And hopefully, if it ends the way that we want, we can get the person to the next level, whatever that may be for them, to maintain the dignity of that patient. So that is part of my job. So what training did that involve? So just like anyone else who's kind of gone through the medical profession spiel and being a physician, I did 4 years of undergrad. So I went to the University of Oklahoma, Boomer Sooner. So I loved my undergraduate training. I actually went down a different path than probably the majority of people who talk about going into medicine. So I actually have a BA in psychology. But then, of course, I did the pre-med track, which I think, again, is what you're going to hear a lot of. So, of course, I got my basic sciences done, all genetics, biology, physics, chemistry, anatomy, all of that I had to do for my pre-med track. But then I also did all the things on the side for psychology, which, to be honest with you, is a perfect example of how you don't have to do one of the classic sciences to enter the world of medicine, as in becoming a surgeon or something of that nature. And psychology has helped me exponentially in my career choice because you don't really think about the amount of conversations you're going to be having with families and the personality types that you deal with in the world of medicine. So my background in psychology, I absolutely am thankful for, and I think it has given me a unique perspective and ability to navigate this field. And so I'm very thankful for that. So after I completed my 4 years of undergraduate training, I moved straight into medical school. Again, I went to an osteopathic school. I went to the Philadelphia College of Osteopathic Medicine, the Georgia campus in Suwanee. And again, this was a choice that I made for myself that I knew was right for me. I grew up in the world of osteopathic medicine. I actually had pretty bad torticollis as a child. And I went to an osteopathic physician who did treatments for me. So this has always been a field for me that is near and dear to my heart. And I then went to general surgery in residency, and I matched in Toledo, Ohio for that and completed 5 years of general surgery training. And then did an additional fellowship year, and that was in surgical critical care, and that was at the University of Florida Shands Hospital. And that was whenever I did my additional training to specifically be geared towards being in the ICU and treating those unique conditions in the intensive care unit. So, can you tell us what a typical day looks like for you? It varies, which is actually part of the reason I love my job. So, it depends on what in my particular group we rotate on a weekly basis. So, I may be a week in the ICU, I may be a week as the emergency general surgeon who's on call, or I may be a week who I'm the trauma provider. And then I also have to do nights. So, it's all kind of mixed together. So, my schedule absolutely changes. So, when I'm in ICU, I round in our trauma and surgical ICU unit, which is typically anywhere between 18 and sometimes up to 34 patients that we see. And that can range from vascular surgery patients, neurosurgical ICU patients, general surgery ICU patients, and then your classic trauma. And so we round as a group. We have a fellowship here in my program, as well as residents and nurse practitioners and physician's assistants. So we work together as a team to treat those patients. I also work as a trauma provider. So during that week, my focus is mainly on anyone who comes into the hospital after sustaining a traumatic injury. And we get them in the hands of the right provider. Let's say if orthopedic surgery needs to get involved, or neurosurgery, or maxillofacial, or if they need to go to the operating room emergently, that would be me. And then lastly, emergency general surgery. So our group takes on all of the emergency cases that come to our hospital. So anyone who comes in with a perforated uh, colon, perforated small intestine, appendicitis, gallbladder disease, hernias. We're talking about kind of those classic general surgery findings that you have to deal with: colon cancers, masses. I actually do a little bit of breast surgery as well, so I do help some of our community, and I do some lumpectomies and some breast surgery. So a little bit of a mix for what I do. This, I think, is so important because everyone's path is different. And if you're going into the world of medicine, I absolutely think that you have to keep your eyes wide open to those things that really stimulate you and really excite you, and the things that are going to last for a long time. And so um, I was drawn to trauma surgery and critical care because one of my passions is talking to people and being there for people. And I don't know that most people classically pair surgery with good bedside manner and talking, but I have an absolute goal to change that idea, because in the world of surgery and critical care, as I mentioned at the very beginning of this, we're seeing people on their worst days. It's the scariest moments of their life. And I absolutely want to be the kind of person who can guide someone through that to ease them a little bit more, or if it's the worst of the worst and they're not going to survive, leave people with a sense of relief and love and caring and dignity. And so that's what that drew me to critical care. Surgery in general was something I always knew felt right for me. So I'm kind of the cliche, I love art and science, and I like the mix, and I like working with my hands and all of these things that you hear. But I knew as soon as I went into medical school and I started my clinical rotations, surgery is a team sport. And I grew up playing team sports. I like working with a group. I like that dynamic, and surgery has all that. It also has the opportunity to constantly learn, and that's what keeps me engaged and keeps me going. Same thing for critical care. I think for some people, you pause in those moments of stress and you're able to organize your thinking, and that kind of is where you're alive. And that's me, as opposed to other specialties where you have your entire day planned, which I think works great for that personality type. Did I always know it's what I was meant to do? I knew surgery was right for me. I wasn't sure about trauma. I actually toyed with the idea of pediatric surgery as well as plastic surgery, which again are on very different spectrums. But what actually helped me to really sit down, and one of my attending providers, Dr. Geiger, whenever I was in residency, had me sit down and draw a Venn diagram, which sounds, crazy. But he really had me sit down and go, okay, make a Venn diagram. What are the things that you're good at? What are the things that bring you joy in life? And what are the things that for you make you excited and passion? And when I did all of that and I sat down and thought about the kind of life that I wanted, the expectations I had for myself and my career, and I was really honest with myself, trauma and critical care fit all of that. And that's what took me down that path. Uh, I really didn't do anything extra special in high school. I definitely did AP classes as much as I could. I think anyone would always encourage you if you can do earlier college career courses in high school. It is helpful for getting your credits out of the way. I actually graduated a semester early at OU because of those AP classes. Otherwise, I took the chemistry and all of those things in high school, but I actually didn't do a lot of medical um, job searching or monitoring or shadowing in high school. It really wasn't until I went to college. I worked at a psychiatric hospital for a while. I shadowed some ED providers. And then, of course, I did my classic basic science courses that helped me get through MCAT and all the things I needed to do to go to medical school. But more than anything, I think you just really need to take some other courses, not just the basic sciences, to really find yourself. I mean, I would argue the courses that helped me the most were the ones that really taught me how to cope with stress, how to sit with myself and in the worst times of my life and figure out how I can get through them without it defeating me. So honestly, the courses I had in psychology and behavioral psychology to me were just as helpful and beneficial for my medical career path as the sciences. I think all of us would agree that this is so important, because when you're diving into a world of medicine, it can very quickly become your entire world and you can lose yourself a little bit. So you've got to kind of keep that part of yourself alive and keep that part of yourself going. So I always grew up playing sports. So I played basketball, I ran track, I did taekwondo. And then as I got older, I danced primarily. So I was a competitive dancer. Um, as I went into college, I actually joined a sorority. So I was Alpha Chi Omega. And I continued to be very, very active in philanthropy, any of the events that we did. We had big campus events. We were at a larger school. So anything that I could be involved with there, I was very, very involved with. I continued to dance. I also paint. So I took classes years and years ago whenever I was in elementary school, but as an adult, I just continued to kind of grow and learn on my own, and I continued to participate in any kind of art, going to museums, traveling, things of that nature. I also love photography, so I continue to expand that. But more than anything, the reason that's so important is because don't lose sight of the fact that without those things that you truly love and the people that are there to support and be around you, pursuing a career like medicine is so much more difficult. So get in tune with those things early, figure out what works for you. I learned that I am not a yoga person. I am not a bath person. I am not someone who, there are things that people are like, you should try this. And I'm like, it's not for me. But take me to a puppy daycare where I can run around with the pups. I'm in, hog heaven. So figure out the things that work for you and don't lose sight of those. So this is another one of those things why I think psychology was so incredibly important. Because in a lot of those courses, those are the things that everyone kind of poo-poos when you're going through, right? Because who cares? I need to get my A in physics, my A in chemistry. I need to, graduate top of my class. But taking the time to really learn yourself and learn what makes you tick early on is going to make the biggest difference later. And it's kind of that delayed gratification idea. But how this applies to studying is you got to figure out what works for you. So I was an independent studier, and I realized very quickly that I really, really needed to write everything out for myself. So I got in the habit of whenever I would be in a class, particularly one that I found challenging, I would go home at night and I would rewrite those key notes and make my own flashcards and make my own books. I didn't do great just studying from slides that someone provided me with. I cannot emphasize enough, particularly in medicine, the importance of question banks and getting yourself in the mindset of being able to answer those and learn the key words and going back through. I do think some people benefit from being in groups and going back and forth, asking each other questions, that's great. Figure it out. But if you're realizing that's not right for you, you got to change it up and not be afraid to change it up if it's not working. So mostly for myself, I was huge on this. You take breaks when you're studying. You absolutely have to. I know that you're the most stressed that you're going to be when you're going through these steps in your life, when you're studying for tests, especially when it's your hardest course. But if you don't pause and take a break for yourself, then you are absolutely not going to be in the mindset. So number one, what I did during residency specifically was if I had a weekend off, I gave myself the entire day of Saturday and half of Sunday where I didn't do anything related to surgery or studying. And I'm completely serious. I made sure that I went out with my friends. I went hiking. If it was nice outside, I walked my dogs. I would take little short trips to places if I could. But you have to completely allow yourself, give yourself permission to not study every single day and to not constantly have that in your mind. You've got to separate it. But then you have to make a plan that at this time I'm going to sit down and get this done. Same thing at night. Whenever I would come home after a long day, my 12-hour shift or 13-hour shift, I would say, okay, I'm giving myself 1 hour to eat dinner, to shower, and to relax for a minute, and then I'm going to do 1 hour of reading and stick to it. You have to get yourself into a pattern no matter, I don't care what kind of study you are, whether it's group or alone or whatever, but you've got to get yourself into a pattern. So I would say the biggest thing for you guys when you're out there is don't forget that the struggles that you're going to go through and that the hard days and the obstacles that you're going to face are normal. They are normal. No one out there is living this perfect life where everything came so wonderfully to them. I have learned the most in the struggles that I've had, whether that's career or friendships or social or whatever that may be. But each time you go through that kind of a challenge, it really can be such a guiding force for you to learn about who you are and how to overcome things. So, don't get discouraged to the point of shutting down. Figure out a different path. Remember that there isn't just that one straight path. There's path A, B, C, D. There's so many different ways to get where you want to go. And just because this person did it in 6 years and this person did it in 15 years, it doesn't matter. At the end of the day, we're all just trying to live this life and enjoy the journey while we're doing it. I'm not trying to sound cheesy. These are words that I live by. And I try to instill in my residents and my fellows, if there's one thing that I can teach anybody, it's that with what I do, I see death almost every single day. I see people coming in with limbs torn off. I see, families losing their 17-year-old daughter, their son, the matriarch of the family. And at the end of the day, this is your life, and it's meant to be something that you love and brings joy to you and that you can use to bring joy to others. So I would, challenge everyone to sit down with yourself and really look at the things that bring you that spark, that bring you that love. And I am actually going to recommend a couple of my favorite books for those of you who are also readers out there, because I love to read. And those books would be The Happiness Advantage, The Subtle Art of Not Giving. And if you are someone who has anxiety, specifically social anxiety, or someone who is a constant people pleaser, this needs to be your book. The Alchemist, that's one of my favorite stories of all time. And it's a great reminder to all of us that when you have a passion, a love, and a desire, the world is ready to give that to you, but it may not come in the exact form you thought. So you have to have your eyes open and your arms open and look for those different signs of, let me go down this path, and maybe it's going to be a couple more years, but the lessons that I'm going to learn doing this are going to be worth it. And then last but not least is one of my favorite books by Brene Brown, and it's called The Power of Vulnerability. And those of you who are the tough ones out there, the ones who nothing gets you down and nothing wears you out, and you're going to overcome everything and you're the strongest one, this is a great book for you because this is one of those books that challenges the idea that by showing the side of you that has failures and showing the side of you that's a little bit, less strong classically, really opens the door to stronger relationships with people and really human connection, that's what we're all here anyways. So, but again, thank you. This is absolutely wonderful. I am happy to answer any questions. You can find my further contact information on the website. Otherwise, good luck on your adventure. And I hope that this is helpful for you. Thank you.